This is PRA Ontario for IMGs. You called, I answered. So you're going to pay close attention to understand where you fall in. I've done for CAMS. So I think you need to go through that video on CAMS before you come to this one so that you understand where you fall in. But for the PRA Ontario for IMGs, which is what international medical graduates in different parts of the world, this is how you can practice medicine in Ontario, Canada, if you graduated from a medical school outside of Canada. Then this is what pathway 2. I've talked about IMGs that want to go through pathway 1, which is what I talked in the previous video. This is pathway 2. Pathway 2 is what Practice Ready Ontario for family physicians. And there is also for specialists. There is another video for that. So you wait for me to do that. I've gathered the information is to put it together and bring it out. Then this Practice Ready Ontario, or what we call PRO, because you may begin to hear me say PRO, is intended for experienced, internationally trained family physicians or general practitioners or medical officers for those in Nigeria, because this is what we miss when we hear general practitioners. We forget that medical officers are general practitioners, and some medical officers have experience in different aspects because they do emergency psychiatry, different things. They are just like the first people patients meet before they even get referred to the specialist. So this is for you to know that as a medical officer practicing in Nigeria or practicing in any part of the world, this is also part of your criteria. It allows eligible doctors to demonstrate that they are practice ready without repeating full Canadian residency. That's what practice ready assessment does for you. PRO is what? Competitive. So meeting the minimum criteria does not guarantee what? Selection. So you have to find a way to what? Optimize yourself so that you can be what? Among those that will be selected. These are the basic PRO eligibility. The applicant needs the following: a Canadian citizenship, a permanent residence. So if you're not a permanent resident of Canada, but you have applied the express entry route and you indicate that you're a doctor, the tendency that you are likely going to get in is high. So you can start now to read for for what you want to do, because Ontario requires that you do what? MCCQE 1 is unlike BC that doesn't require MCCQE 1. You see the difference now. I always tell you guys that each province with their own. So if you're coming in into Ontario, probably for provincial nomination for your PR, just know that you're going to be writing MCCQE 1 for you to practice as a doctor there through the practice ready assessments, which means you're not going to be doing residency. That's what practice ready means. Then you have to have a medical degree from a school listed in the World Directory. You have to have a proof of English proficiency, IELTS, OET, or CELPIP, whichever one. OET, a minimum of B, IELTS, a minimum of 7 across board, CELPIP, a minimum of 9 across board, and each of them must be in one sitting. Then we have the LMCC, or completion of the LMCC requirement while awaiting issuance. So you will make sure you complete this depending on what is obtainable as at the time, because the things change. So as at the time, if you're not applying this year, what may happen next year may be different from what is happening this year. So make sure you update yourself. Then you do your NAC, or you can do your NAC OSCE. NAC examination taken from March 2013 onwards. You know, it used to be called MCCQE 1 and MCCQE 2, but they've removed MCCQE 2. It's now NAC exam. So they only take those that took NAC from 2013 upwards. This is a very critical information you need to know. So if you wrote NAC before 2013, you are not qualified for PRO. That's simply what it's saying. Then they need a pass in therapeutic decision-making exam. And remember, for you to write a therapeutic decision-making exam, you need what? Eligibility letter. So Ontario must have given you a letter saying we are going to be taking this doctor once they pass a TDM exam. So for you to write a TDM exam, you need that eligibility letter. It means you would have passed your MCCQE 1, applied to Ontario, told them, okay, you want to do what? You want to practice as through the practice ready pathway in their province. They are now going to assess your documents, go through it, see, okay, are we ready to take this person? If they're ready, they will now give you the eligibility letter to tell you, okay, go and write your TDM exam. So that once you are passing TDM, you are letting them know you've passed TDM so that they can start your what onboarding process. And at least for 8 months of combined postgraduate training is required, or independent family medicine or general practice experience. So remove house job. How many years have you practiced? That is what you need to ask yourself. If you remove your house job experience, how many years have you practiced? So if you fall within the 48 months, which is what? 48 months, 12 months, 1 year, 48 months is what? 4 years. This is Ontario. You can see now that there are discrepancies in the requirements of Ontario, BC, Alberta. So know what it's obtainable for each province, because Canada is vast and wide. So each of them with their own. Then at least 960 hours of family medicine practice during the preceding 3 years. So preceding 3 years, that's if you have practiced for 5 years, the last 3 years, you have at least 960 hours in family medicine practice. Then at least 720 of these 960 hours delivered in person. That's, you're not practicing online. There is what we call telemedicine in Canada. You are not doing telemedicine. That is not virtual consultation. Is what? An in-person practice. Then you require a means number. I'm going to explain this means number as we go. Then you require MCC candidate code, Canadian or international driver's license. You require a curriculum vitae that is equivalent to the PRO what requirement. Not that kind of CV that some people used to do, especially my people from Nigeria. So you have to do what your curriculum vitae to meet their requirement. Then this is me now, and I want to tell you that people may forget what you said, but they will never forget how you made them feel. This is me asking you to please subscribe to my channel, share with your friends, invite them, and do what? Drop a comment to just say, even if it's thank you, so that you can make me do what? Feel good. So now, basic PRO eligibility continues. These are the required clinical rotations that are accepted, or they also have equivalents. I'm going to delve deep into explaining the equivalents to you, but now pay attention to what is accepted. Family medicine or general practice, minimum of 8 weeks. Emergency medicine, minimum of 4 weeks. General surgery, minimum of 4 weeks. Internal medicine, minimum of 4 weeks. O&G, minimum of 4 weeks. Pediatrics, minimum of 4 weeks. Psychiatry, minimum of 4 weeks. Why am I explaining this? Some people will say is psychiatry. Among psychiatry is very important because mental health is not joked with in this part of the world. So you need your psychiatry to be what? Top notch. Clock it. So the rotation must be completed through an approved university affiliated postgraduate program. Observership and ordinary community experience do not count as postgraduate rotation. What do you understand by observership? Those in Canada already will understand what I mean by observership. Observership means like, okay, I probably have passed MCCQE 1 and I'm going to the hospitals to see what they are doing, how they are treating patients, what they are doing to patients, but I'm not actively treating anybody. So it does not count. Ontario is telling you that they do not accept what? Observership. So now you know the rotations that are required. If you have not gone through any of them, please go back and do them. Then these are the accepted equivalents. These accepted equivalents come in handy as alternative when you are missing up to 3 of the rotations. That means you are missing up to 3 out of the 7 rotations, you're missing up to 3. They are likely going to take this equivalent 1 year of independent family medicine or general practice experience that included work in the missing area. may count as 4 weeks of postgraduate training in that area. Let me take it, for example, you are a GP or a family medicine physician, and during your training, you went to do emergency medicine posting, and in that posting, you spent up to 4 weeks. You have to be able to prove that you did emergency medicine. Let me give, for example, during our house job, as somebody that did house job in Nigeria, that's internship. When I did internship, during surgery posting, you do orthopedic posting and you go to emergency. So during that posting, you are doing emergency medicine, you're doing orthopedics, so that whole period, is it up to 4 weeks? If it's up to 4 weeks and you have a senior registrar or your HOD that can prove and say, okay, this person did this rotation and it lasted for at least a minimum of 4 weeks, it can be more, that counts, and that can also be taken. That's equivalent. That's what they are explaining to you. You can be doing a posting in surgery, or you can be working in surgery and you are also doing locum or doing a medical officer in a private hospital. You're working as a medical officer in a private hospital and you are doing surgery, but you have these rotations somehow that you can prove. They may be able to take it if they assess it and see that is what they want. I do not have the final decision, but I'm giving you examples. So experience obtained within another rotation may also cover the missing area if the applicant can prove that the relevant clinical work was included. Let's take it that when you did in family medicine, probably you just started and you did a rotation in O&G. Let's take, for example, this will be the best example I will give you. Probably you've been working as a medical officer and recently you just started residency in family medicine and you are still within your first 1 year in family medicine, but you have done rotation in O&G and you've practiced as a medical officer. These experiences can be culminated and be used as a rotation for you. The applicant must provide an attestation from an authorized physician. You see what I'm telling you? So it has to be what? Provable. A senior healthcare administrator who can confirm the applicant's what? Experience and clinical skills. PRO makes the final equivalency decision. I do not make it. That's what I'm trying to explain here. Then full meaning of MINC, I said I was going to explain it. So MINC means medical identification number for Canada. It is a unique identification number assigned to individuals entering or participating in Canada's medical education and practice system. It helps approved organizations accurately identify the same physician across examinations, trainings, registration, and licensing processes. So this number will help them identify you, whichever licensing you're going through. Then a MINC number is normally assigned only once, remains with the physician throughout their career, is not a medical license, please. Somebody can still decide to stop practicing medicine, but they will still have their MINC number. So it does not by itself authorize anyone to practice medicine. Then is different from an MCC candidate code. It is different, and a CPSO registration number is different. So I said I was going to explain it. You may not need the explanation now, but that's the explanation. But it is required. That's part of the requirement. You need what? It means MINC number. Then this is PRO process, phase 1, eligibility review. Immigration status. I told you you are either a citizen or a permanent resident. Medical education. Is it verifiable? Is it complete? Is it acceptable? Language proficiency. Have you done it? Is it within the last 24 months? MCCQE1 NAC. Have you done it? Have you passed? Postgraduate training. Is it verifiable? That's all the postings that you've done in medicine. Can they be verified? Independent family practice experience. Do you have any experience in family medicine? Can they be verified? The required rotations that I explained, the core rotations, all the 7 core rotations, do you have experience in psychiatry? You know why I'm pointing on psychiatry? Because I've gotten lots of questions about psychiatry. Can it be removed? Psychiatry is part of it. This part of the world, They don't joke with mental health. So psychiatry is important. Then currency of your clinical practice. Have you been out of practice for years? If you have been out of practice for years, you need residency. BC will normally tell you to go back to your country and practice for a minimum of 6 months before you come back for practice ready. So depending on when you stopped practice, they are going to assess your currency. Ontario says what? The last 3 years. So looking at that, that should help you place yourself where you belong. I hope this is helping somebody, please. Phase 2, verification and selection. Eligible applicants should what? Submit supporting documents. So if there is any supporting document you know or you have, if you've done masters in public health, occupational, any other supporting document you know that can increase your chances, please add it or add them. Complete the therapeutic decision-making exam if not already completed, because why they tell you this is because you need what? Eligibility what? To write the exam. Then you write it, and with this eligibility you can write the exam, and if you've not signed contract with any province but the province gave you eligibility, somehow I will always tell you that go to the ones that gave you the what? Eligibility to write the TDM exams. It's just you keeping to your words. Then attend an interview. If you pass, apply to CPSO for the required provisional certificate, because you need a provisional certificate before you even start doing anything. It is when they now approve this provisional certificate, that's when you will start your what? Provisional certificate is when you will start your practice under supervision first. Then phase 3, clinical field assessment. Selected applicants complete program orientation when you get your provisional certification. Program orientation, a 12-week supervised clinical field assessment in Ontario. Before starting the assessment, the candidate signs a 3-year return of service agreement, so that after all this, you are remaining there. Because some people, they just have it in mind that, okay, once I finish, I will leave. You can't leave. You sign the return of service agreement. Please keep to it. Let's learn to keep to our words, please. Then PRR assigns the assessment site, while candidates are subsequently offered eligible communities for their return of service. Successful candidates proceed into practice under the certificate and conditions authorized by what? CPSO. The full journey from application to commencing return of service can take up to 1 year or longer if spaces are limited. So it means it depends on the number of availabilities or the communities that are posting you to. That's why I always say, if you know what can make you stand out, add it in your application. They are all things that someone may be looking at, assessing your application, and be like, okay, I think we need this person. Make sure you stand out. And if you have any questions or you don't understand anything I've said in this video, drop it in the comment. I will respond to it. This is PRA Ontario. Please subscribe, share, like, and invite your friends. Peace out. Clock it.